Welcome. My name is Peter Strong. I am a professional psychotherapist based in Colorado, but I offer online therapy via Skype worldwide. The advantage of online therapy is, of course, twofold. Mostly convenience, and the second factor being one of greater comfort for you as a client. It's much less intimidating being able to talk to a therapist online rather than going to a therapist's office. That is what most of my clients really like about Skype therapy. So as long as you can see each other, then there's no significant difference between Skype therapy compared to meeting with a therapist in person. The most important thing is that you see each other, because that's important for communication. But other than that, it's a very, very effective way of getting the help that you are looking for, and it's especially convenient if you are living in an area or living abroad where it's difficult to find the right kind of therapist to work with. So convenience is a big factor as well. Also, many people seek me out specifically because they're interested in mindfulness therapy. So I specialize in the use of mindfulness for working with difficult emotions, and that includes anxiety, depression, addiction, and also emotional trauma. So I work a lot with post-traumatic stress disorder, and using the techniques of mindfulness therapy, I can help you overcome the emotional trauma caused by intrusive memories. This is the most disturbing part of PTSD, the intrusive memories of traumatic events, sometimes called flashbacks. But the important thing to understand here is that you can overcome emotional trauma with the right approach and the right tools. It's very important that you do heal emotional trauma to prevent it from basically igniting secondary reactivity, such as depression and extreme anxiety and addiction. These are secondary reactions to emotional trauma. So emotional trauma is basically any form of experience that the mind and brain is unable to process. It's unable to digest that experience. So whether that's an experience of death in a war scene, or whether it's seeing an accident on the road, or some other traumatic event, natural disaster. All of these kind of experiences are not commonly encountered, so the mind is not equipped to deal with that amount of intense emotion and intense sensory experience also. So it becomes overwhelmed, and that emotional trauma becomes suppressed and does not heal. So how do we go about healing emotional trauma? How do we work with PTSD? Well, the methods that I find most effective and that I will teach you during our sessions together is called Mindfulness-based Imagery Processing. This is a very simple approach that can be remarkably effective for working specifically with traumatic memories. So what makes a memory traumatic? Well, it's not just the experience itself, but it's how that experience is represented in the mind in the form of imagery. This is the real underlying issue with emotional trauma. So that intense emotion gets encoded as intense psychological imagery. That might be memory imagery from the actual event, or it can be a different kind of abstract imagery that represents the terror or fear that was triggered at that time. But the main principle here is to understand that the organizing principle that keeps trauma alive and stops it being processed is the imagery. That imagery becomes stuck, if you like, in the mind. So working with emotional imagery is very important, and it's really the most important thing we need to do to heal the traumatic experience. So the typically traumatic imagery has certain characteristics that keep it in place. One of those is that the imagery is too large in size, too close. In a case of a flashback, it becomes so close that it basically completely consumes us, and we are effectively reliving that experience. We become part of that imagery. So it often will also be very vivid in color, so it's very vivid. So these are the kinds of characteristics that keep that emotional imagery in place and keep producing the emotional trauma. However, that imagery is itself the product of habitual conditioning. It gets stuck in the mind, if you like. The problem is simply that the imagery does not change. So we can overcome this by bringing in consciousness, which allows us to work with that imagery and change it. So even very simple changes, such as reducing the size of the image, can have a dramatic effect on reducing the intensity of the traumatic memory. Moving it further away can greatly reduce its impact. Changing its position, typically intense emotional imagery is very high, so we can move it down. We can change this habitual imagery when we focus conscious awareness on that imagery, which is what we do with mindfulness-based image processing. We look at the imagery. That is what is keeping that trauma in place. And when we change that imagery, we change the trauma. We help it heal. We help it become digested and processed in a natural way. This is how the mind processes emotions in general and emotional experiences. It basically changes the imagery of that experience, and often the imagery is diminished so much that it becomes forgotten, becomes insignificant. But it's the imagery that's the key here. When we can change that imagery, we can promote the healing of the trauma. So if you'd like to learn more about how to work with trauma and heal the underlying emotional imagery that's sustaining that trauma, then please contact me and let's schedule a Skype therapy session. This approach is very detailed and very focused, very practical, and I will teach you how to go about working with that emotional imagery and how to practice at home between sessions. That's really important. The more you can change the imagery, the more the trauma will heal. So this approach is very effective because it's very practical and very focused on the mechanism of trauma. And most people see quite dramatic changes within the first 3 or 4 sessions. So please contact me if you would like help in healing from traumatic memories. Thank you.